thank you for making it possible for me to get here, and to Senator Daines for having a very important hearing to discuss access to health care in rural communities, which is critical certainly in my home state of South Dakota. And I want to thank our panelists for joining us today and the work that you are doing in your communities to improve access to health care. We got a lot of, strains put on rural healthcare providers by the pandemic, and in some very difficult circumstances, the challenges of attracting and retaining workforce is become even a more significant issue that they have to deal with. And we've had providers in South Dakota work really hard to find innovative solutions, how to reach patients, but there are still barriers. And I look forward to working with my colleagues on this committee to advancing solutions that will meet some of those challenges. Let me just say, I've heard from many of the hospitals in South Dakota about the impact of the workforce shortage that it has on their ability to discharge patients from the hospital. Often, even though a patient is ready to be discharged to a long-term care facility, because the long-term care facility has a shortage of staff, they aren't able to take these patients. In South Dakota, these patients are waiting as much as 45 days in the hospital to be discharged. In one recent case, a patient waited 150 days before being placed in facility, and then it was to a facility in a different state far from his family. Further, I'm concerned this issue could be exacerbated by a potential requirement from CMS that would mandate staffing ratios in nursing homes, something we've heard a lot about. So we need to ensure that burdensome regulations do not get in the way of providing high-quality care for patients, and instead we need to work on tailored solutions for our rural communities. So, Dr. Holmes, you mentioned that in order to grow the rural health workforce, we need to support healthcare workers across their entire career. At the federal level, there are grants to support training and loan relief to recruit providers to certain areas. What other ways can we help support providers to both train and remain in rural areas?
We've talked about the bonus payment program earlier, so that would be another option to continue to make it more financially sustainable to practice in rural areas. It's not just getting them there, but keeping them there to that point.
Right.
We know that workplace violence has been on the uprise for a while in terms of, I guess, really anger at many healthcare workers, and what can be done in that space.
We've got, and I'm sure you guys have covered this already, but this mandated staffing nursing ratio issue, talked about that, exhausted that at some length. If you've already talked about that. If you haven't talked about that, I'd love to get your reaction to that.
That's the first time that's been raised, I think.
Okay.
I believe it's about the care of the patient rather than mandating a particular ratio. It depends upon the acuity of the patient, the illness of the patient, and what the patient needs at that particular time. I think it's a very coarse tool that's unlikely to be completely successful. We have nursing professionals within each one of our facilities that know what it takes to care for a patient. I do think that if you're not caring for patients well, there are certainly regulations that allow for that to be addressed. But to mandate a ratio, I think, is a blunt tool that won't, number one, will inhibit hospitals from being able to provide the care they need to provide, and will not have the intended outcome of patient safety.
And I hope they'll take that into consideration and relook at that. Unfortunately, increasing the pipeline of providers in rural areas isn't going to happen overnight, and telehealth has been as good a bridge as we have for getting there. I continue to work with my colleagues on the Connect for Health Act, which would eliminate barriers to telehealth and Medicare, including allowing rural health clinics to provide access to services through telehealth. Ms. Ani, during the pandemic, rural health clinics were able to act as distant sites for telehealth services, enabling many patients to have access to health services. Could you tell us more about your experience using this flexibility during the pandemic and how making this permanent could benefit patients?
Yes, it was very beneficial to patients. But like everyone else on the panel has said, we use a lot of audio only because our community may not have a computer or internet. So if we could integrate that some way within a payment system would be great. We have a lot of providers that will just call the patient because the patient will call day of appointment, say they can't make it because they don't have a ride to the appointment. They may be 60 miles away, and so the provider will actually just do a telephone visit with them, and a lot of the times those aren't even billed because patient or provider doesn't bill them, or their call with their results and stuff, so.
Yeah. Well, and the Connect for Health Act does permanently add rural health clinics as a distant site, and we have 58 rural health clinics in South Dakota. Do I have time for one more, Mr. Chairman? Sorry, I know you're... So anyway, we've got 39 critical access hospitals across the state of South Dakota, and these hospitals serve an essential, as essential healthcare provider in areas where there may not be another healthcare facility. Dr. Herman, you highlight the challenges that Essentia's critical access hospitals face with arbitrary regulatory requirements like the 96-hour rule. As you know, this rule was waived during the pandemic health emergency. Could you describe how the waiver of this rule during the health emergency helped critical access hospitals better serve patients, and what challenges are those hospitals now going to face if the rule's back in place?
We firmly believe that the best care a patient can get is the care that they can get closest to home. You have the support of your family and you have the support of your community, and we know that those are incredibly important in promoting the wellness and the healing of the patient. What we saw during the pandemic is that waiver of the 96-hour rule did several different things. First of all, it allowed those critical access hospitals to retain their staff. When you have widely fluctuating census, it's hard to keep the staff because people work Monday and Tuesday and then they don't work for the rest of the week. Number two, it allowed them to really build their capabilities to take care of sicker patients. They became more confident in their ability to do that and allowed them to keep those patients closer to home. Our concern is, and the other part of it is that we did not have the capability in the larger hospitals to take care of those patients. A lot right now towards the post-acute care, there's about 2,000 patients every day in Minnesota hospitals that are waiting to get to a skilled nursing facility or post-acute care. Where do those patients go? If we can stabilize the staff and build the capabilities of those critical access hospitals, I believe it'll go a long way to their success in the future.
Okay. Well, we look forward to working with you on that. And, Mr. Chairman, I thank you again for giving me the time.
Sure.
Thank you.
Thank you,
Thank
Senator
you all
Thune.
very much.